Colombo's skyline speaks volumes of the city's expansion. Now, looking at the futuristic plans of development and urbanization, will Sri Lanka be able to eradicate HIV/AIDS from the country? Let's find out on this special report. UNICEF's report, released on World Day for HIV/AIDS, says that the number of adolescents infected with HIV/AIDS will increase by 60% by the year 2030 globally if preventive measures are not taken. UNICEF also in its report emphasizes the need to create awareness among the young adults in order to safeguard their adolescent years 14 years from now by taking preventive measures through proper education about the ways of transmission of HIV/AIDS to avoid such a scenario.
Everyone should know their HIV status. That's critical. Without knowing, without being tested, you don't know, so you can't take treatment action. Clearly, if Sri Lanka does not continue to improve its services for young people to prevent infection, to improve access to and quality of testing, and improve access to knowledge and the skills they need to protect themselves. Clearly, if we don't do those things, the epidemic will spread.
In this backdrop, the National STD/AIDS Control Program says that the country intends to fully eradicate the prevalence rate of HIV/AIDS by the year 2025. The Director General of the program, Dr. Sri Lanka, also highlighted the free-of-charge facility provided by the state-sponsored institution to conduct laboratory tests.
And what we're trying to help the government is to increase the number of people who know the status to 90% of the estimated number. That is the current challenge in Sri Lanka at the moment.
As much as there is 0.01% only of the population in Sri Lanka that is infected, it is certainly a low number. But what we are worried about is that there are certain key populations, and if you're not getting tested, that this number is going to rise. And it can rise, like in many countries, into a full-fledged epidemic.
Prevention is better than cure seems to be the recurring theme in the effort to end HIV/AIDS, especially at a time when the country is seeking rapid growth. Reports say that 70% of the world's population will be living in towns and cities by the year 2050. With increased mobilization and social interaction, experts believe that we are at a crucial time to be armed with knowledge about the sexually transmitted disease now more than ever.
People need to be aware of how HIV is transmitted. People need to know the status, as we talked earlier, and they need to take adequate precautions to ensure that wherever they are in the country, they are well protected.
We in society are compelled to thread the needle between stigmatization and victimization. Behind this concrete jungle and the glimmering city lights, there remains a need to brave the prospects of being infected as much as there being a need to exercise empathy towards those who have fallen prey to this vicious disease.
As the President's Council, former Secretary of the Bar Association, former Deputy President of the Bar Association, I appeal to the legal fraternity. I appeal to all professionals to get together and say this stigmatization must stop and we must change our attitude. This is what professionals like us can give to the society.